Coming up, sharpening your knowledge on GI tumors. An April webinar keeps surgical pathologists current on the latest skills and guidelines. Plus, how physicians really feel about patients consulting Dr. AI on their test results. These stories and more next. This is the Path News Network Daily Edition from the College of American Pathologists. I'm Elizabeth McMahon. It's Wednesday, March 18th. A gastric or esophageal cancer diagnosis is scary, but new treatments are improving the standard of care. If you're a surgical pathologist, the CAP's Interactive Surgical Pathology Case webinar on GI tumors on April 16th can help you stay on top of the most current knowledge on testing and specimens. The course includes updated CAP guidelines related to HER2 testing in gastroesophageal adenocarcinoma. In an upcoming episode of the CAPcast, the CAP's podcast with leading pathologists in their specialties, Dr. Catherine Struker, an expert committee member on the HER2 testing guideline panel, discusses the changing landscape for treatment of gastroesophageal cancers.
Patients have access to an increasing variety of first, second, and third-line therapies. This has very much changed how oncologists approach treatment. It must be very complicated for them because now they have to take into account all the other biomarkers and targeted therapies that are available for upper GI cancers, particularly immunotherapy and Claudin 18.2 targeted therapy. They now need to sort through the results of these multiple different biomarkers and balance out what combination of therapies and their associated side effects would be of most benefit to the patient.
Register for the live-streamed GI tumor webinar using the link on the CAP homepage, and stay tuned for the CAPcast discussion with Dr. Struker and Dr. Kelsey McHugh of the HER2 Guidelines panel coming soon. Meanwhile, research links your gut health to overall health, but what happens to your gut microbiome's delicate balance when you take antibiotics? A new study in Nature Medicine of nearly 15,000 adults in Sweden compares the gut microbiomes of people who took antibiotics at some point over 8 years with those who had not. The Uppsala University researchers found that even after 8 years, the gut microbiomes of those who hadn't taken the drugs were far more diverse than those who had. The effect of clindamycin, sometimes prescribed for skin and dental infections, were most notable. Each course of clindamycin was linked to an average of 47 fewer detected bacteria species, as well as changes in abundance of almost 300 of the 1,340 bacteria types they analyzed. A recent article in Lab Manager magazine provides a playbook for laboratory safety and operational disruptions with practical advice from safety experts. Dr. Jason Nagy says you should start by looking at what could go wrong and creating a plan to mitigate failures. He's a safety support coordinator for Centara Health, a hospital system based in Norfolk, Virginia. You can learn more about risk management in the CAP's Laboratory Medical Direction online course and workshop. And finally, should patients use AI to interpret their pathology or radiology results without a doctor? If your answer is no, more than half of physicians disagree with you, according to a survey of nearly 1,700 physicians who participated in a recent American Medical Association survey. The AMA's 2026 Physician Survey on Augmented Intelligence found that most are okay with patients using AI for medication and general health questions, but they draw the line at test results. The number of physicians who now use AI in their practices more than doubled to 81% since 2023, but most said they wanted more AI training. More than 3/4 of physicians said they believed AI improved their ability to take care of their patients. That's all for today's Daily Edition. Be sure to check the show notes for more information on today's stories. Watch your inbox for more news like this in the CAP's Advocacy newsletter every Tuesday and our weekly edition newsletter on Thursdays. We're back at 5 a.m. Eastern for another episode of the Daily Edition. I'm Elizabeth McMahon. Have a great day.